Good morning, everyone. Welcome to our E&M Correct Billing for Non-Physician Practitioners webinar. My name is Ashley Decoto, and I am a specialist with our Provider Outreach and Education team. On the call with me today is my friend and colleague, Leanne Foster, who you just heard from. Leanne is going to be helping out with the chat. First, I have just a few housekeeping items to go over. We will have a recording of this session available in the Training Center on our website. The Training Center is linked here on this slide, and Leanne will be adding a link to the chat. It will be available on our website for the next 60 to 90 days, barring any technical issues with the recording. And you can actually access this without having to access YouTube, as we do recognize that not everyone is able to access YouTube from work. The recording will also be available on our YouTube channel as long as the information remains relevant and current. So that will be out there for you to rewatch, or if maybe you have someone in your organization who was not able to attend today and wants to watch the recording. Also in our training center, you can find a copy of today's presentation. So if you haven't already grabbed that, it is still available for download if you'd like to have the presentation to follow along or maybe to take notes, though that's not required. We are taking questions through the chat today, which again, Leanne will be monitoring. I will check in with Leanne at the end of the presentation, time permitting, for any questions in the chat. This webinar is scheduled for 45 minutes, and I will be addressing pre-submitted questions related to today's topic throughout the presentation. If we don't have time for live chat questions, or if maybe we have more questions than time allows for, not to worry, I will put together a follow-up email that will include answers to questions that we were not able to get to, and I'll send that out to all attendees. We would appreciate you taking some time to provide feedback on our education. Towards the end of the presentation, you will be provided with a couple different ways to take our survey. We would love to see your feedback on this session, as well as suggestions for future education. Here we have our disclaimer slide. The information given today is as up-to-date and accurate as we can make it. Now, as many of you may know, Medicare rules do change often. We will respond to questions today based on the information provided, but CMS rules determine final coverage. The most current information may always be found on the CMS website, which we have linked for you here. Lastly, on this slide, CMS prohibits recording of this presentation for profit-making purposes. So if you are recording or taking screenshots, we do ask that you stop. We are recording this presentation ourselves, and we'll have the recording available on our Encore page in the training center of our website within the next week or so. And again, the recording will also be available on our YouTube channel. Here's our agenda. I will be providing information on non-physician practitioner or NPP billing when working under different scopes of practice and providing multiple visits within 3 years or multiple visits on the same day. We had some pre-submitted questions looking for updates. We do not have any updates to share for non-physician practitioner billing. However, the information I will be sharing today is based on a change that WPS made in December of last year, and we are still seeing non-physician practitioner claims being submitted incorrectly. This presentation is specifically for Part B claims submitted on the 1500 paper claim form or 837P electronic submission. The information we're presenting today does not apply for outpatient claims submitted on the UB04 or 837I electronic claims. Before we get started, we did have a pre-submitted question asking about annual wellness visit requirements. We're not going to be covering annual wellness visits today, but we do have a playlist on our YouTube channel specifically on annual wellness visits. All right, this slide contains the acronyms that we will be using today. I've gathered these all in one place so you have this for reference. Some of you may be familiar with these, but I do include this as we may have some attending that are newer to billing Medicare and maybe not as familiar with these acronyms. And again, if you've not already downloaded today's presentation, it is still available on our website in the Training Center under Live Events. So feel free to download that so you have this as a reference. The non-physician practitioner specialties that we're going to talk about today include nurse practitioners, physician assistants, and clinical nurse specialists. When non-physician practitioners enroll with Medicare, they do not identify what specialty they will be working under. They only enroll with their designation, which would be the two-digit codes as I have shown on this slide. So nurse practitioners enroll as specialty 50, physician assistants are specialty 97, and clinical nurse specialists are specialty 89. And Medicare uses these two-digit specialty codes to process claims. We do not use taxonomy codes. We had a pre-submitted question asking if there are any differences for non-physician practitioners. This is the key difference, that non-physician practitioners do not identify a specialty during enrollment, but instead enroll with their designation, which is one of these two-digit specialty codes. We had another pre-submitted question. How do subspecialties factor in? Non-physician practitioners do not have subspecialties on their enrollment record, but for the purpose of this presentation and for claims processing, the subspecialty is the specialty they are working under rather than the two-digit designation used for enrollment. These non-physician practitioners enroll as a specialty of 50, 97, or 89. Enrollment systems actually do not allow for the addition of a subspecialty for non-physician practitioners. However, we are going to talk today about how you can indicate a specialty for non-physician practitioners in claim submission when appropriate. We had one more pre-submitted question which asked, what are the main differences between CNP and PA mid-level billing? For Medicare purposes, both NPs and PAs are able to bill for services under their own NPIs and are reimbursed at 85% of the fee schedule. The information I'm providing today does apply to both PA and NPs. All right, for new patient services. New patient E&M services are billed only for a patient who has not received any professional services from that same physician or non-physician practitioner or another provider of the same specialty from the same group practice within the previous 3 years. For new patient services, same group practice means under the same tax ID. For same specialty, another provider of the same specialty is based on the two-digit code that is used for enrollment, like we looked at on the last slide. So for a nurse practitioner, physician assistant, or clinical nurse specialist, they would not identify what specialty they might work under during enrollment. Their specialty, again, is their designation as a nurse practitioner, physician assistant, or clinical nurse specialist using that two-digit code. So if a patient is seeing your nurse practitioner today, which is specialty 50, and has seen another nurse practitioner within your practice within the previous 3 years, today's new patient visit would deny based on the specialty code 50 for both nurse practitioners. Now, if those nurse practitioners are working under different specialties, we do have a way to indicate that on the claim to avoid this type of denial, and we're going to look at that in a few slides. So here we have the Medicare rules for multiple evaluation and management services in a day. For Medicare purposes, evaluation and management services are considered per diem services, meaning one per day. So this means that Medicare only pays for one E&M service when provided by the same person or a member of the same group with the same specialty on the same day. So if you are using time to choose your level of procedure code and have multiple services in a day from the same group and same specialty, you would add that time together. You may also look at the prolonged care codes when combining time in these situations to see if those are applicable based on your total time. If you're using medical decision making to choose your level of service and have multiple services in a day, you will look at the totality of the documentation from both practitioners. Then determine your level of service based on the combined documentation. Again, this is if the services are provided by the same person or members of the same group with the same specialty. There is an exception to the per diem rule, which is for services that are not related and could not have been provided at the same time. For example, Nurse Rachel sees the patient in the morning for treatment of diabetes and then sees them later in the afternoon because they now have severe abdominal pain. They did not have the pain during the visit this morning, so the service could not have been provided during the visit to treat diabetes. We had a pre-submitted question about multiple services in a day, which was if an MD and non-physician practitioner see a patient on the same day and are the same specialty, and the MD selects level by medical decision making, and the NPP selects level by time, how do we charge this? So non-physician practitioners and MDs are not considered the same specialty. But if they are working under the same specialty, is this truly a separate service, or is the non-physician practitioner providing the service incident to under the MD's plan of care? Or if it's in a facility, is this a split shared service? If you are billing separate services, make sure that the documentation supports it. A reviewer may ask why the MD and NPP are providing services on the same day and ask if they are really separate services. Do their services stand alone, and does the documentation support it? In order for your claims submitted to WPS to process correctly, non-physician practitioners are able to identify the subspecialty they work under. So we talked about multiple visits in a day, for example. Well, for non-physician practitioners, the claim processes based on the specialty codes we looked at. So if two nurse practitioners from your group practice, for example, are providing an E&M service on the same day, those would both be submitted with specialty code 50, and the second service would deny. But if the two nurse practitioners are working under different specialties, for example, Nurse Rachel is working under cardiology, let's say, to treat Betty beneficiaries' high blood pressure, and Nurse Monica is working under pulmonary disease to treat Betty's asthma, they are able to indicate which subspecialty they're working under so that both services would be payable. And we'll look at how to include that subspecialty information on the next slide. Same thing would apply for your new patient services. If Nurse Rachel and Nurse Monica are in the same group practice, but working under different specialties, and both submit new patient services within that 3-year time frame, the second service would deny because both claims are submitted with specialty code 50 for the designation of nurse practitioner. Again, there is a way that you're able to avoid these denials by including certain information on your claim, which I'm going to show you on the next slide. So beginning December 1st of last year, WPS initiated a claims processing solution for these non-physician practitioner claims to help you avoid denials and reduce your need to appeal. So for your nurse practitioners, physician assistants, and clinical nurse specialists, you are able to now identify what subspecialty you are working under by using the narrative section of the claim. So for those of you who still submit on the 1500 paper claim form, this would be in item 19. And for your 837P electronic transactions, this would be the loop 2300 NTE segment or the line NTE in the 2400 loop. You will add the 2-digit specialty code and the description, such as 06 cardiology or 29 pulmonary disease, like the examples you see here on your screen. You can find a full list of specialty codes on our website, and I have that linked for you on the resources slide, and I'm actually going to pull that up now so you can see what that looks like. So here's the list of specialty codes, which again is linked on slide 15. These are specialties, they were specialties, here we go. These are specialties that are recognized by Medicare, and they can be used for these non-physician practitioner new patient services or for multiple services in a day. And I've given the example of 06 for cardiology, like you see here, or 29 for pulmonary disease, like you see right here. But if your NPPs are working under any of these specialties, these are the codes and descriptions you'll want to use in the narrative to avoid those denials. Now let's look at how WPS will process these non-physician practitioner claims, meaning claims for multiple services on a single day or for multiple new patient services in a 3-year period. WPS will evaluate the specialty and diagnosis for each service. If the service is the same subspecialty, we would deny. So let's take Nurse Rachel and Nurse Monica again. If they each are submitting a service provided today for Betty beneficiary, both under specialty 06 for cardiology, the second service will deny. Now, if they are submitting under different specialties and the diagnosis for each service is unrelated, both may be eligible for payment. But that subspecialty will need to be indicated in the narrative of the claim using the 2-digit code and the description. The same thing applies for multiple new patient visits done by non-physician practitioners in your practice working under different specialties. We had a pre-submitted question that indicated you wanted to avoid billing mistakes. You want to make sure this information is included on your claim to avoid any unnecessary denials and prevent the need to appeal. So how will you determine whether to submit for a new or established visit for services provided by your non-physician practitioners? You'll want to evaluate your records for a previous new patient visit by another non-physician practitioner. If there was another new patient visit by another non-physician practitioner, were they working under the same specialty? If so, then you have an established patient visit. If not, we move into the diagnosis. Was the treatment for the same diagnosis? If yes, then again, that's an established patient visit. But if the visit was to treat an unrelated diagnosis, then you are able to submit a new patient visit if the services were provided under different specialties. You'll need to include that subspecialty information in the narrative of your claim. Otherwise, the claim will deny with a previous new patient visit done by another non-physician practitioner within your practice. Now let's look at what you'll do for multiple services in the same day. If the services are related, meaning to treat the same or a related diagnosis, you would combine the documentation and submit for just one service. So this is like what I talked about earlier. If you're choosing your level of service by time, combine the documentation and add up the time. And again, it may mean that you're able to bill prolonged care codes based on the total time. If you are using medical decision making, again, look at the combined documentation and use this to determine your level of service based on elements of medical decision making. We did have a question that asked about level of service, which asked if coding a level 5 using time, does the primary diagnosis matter? When using time, the diagnosis does not determine the level of service, but you want to make sure your documentation justifies the amount of time spent for that visit. So if you are treating a sinus infection, for example, and your total time is 120 minutes, that amount of time probably would not make sense for that diagnosis. The level of service and what the documentation supports needs to make sense to a clinical reviewer. Since we won't be going into detail on choosing your level of service during this webinar, I did want to share that we did a webinar specifically on choosing your level of service, and I've asked Leanne to place a link to the recording of that webinar in the chat. We had a few pre-submitted questions about documentation, and we're not really going to get into detail on documentation today, but what I will tell you is to make sure that your documentation supports the level of service chosen. And again, that video on choosing your level of service is going to go into a lot more detail. All right, so the next thing to consider here on this slide is if services are unrelated. If the services on the same day are unrelated, meaning you're working under different specialties and providing treatment for different medical conditions, you would include this information on your claim. So you would add in the 2-digit specialty code and the description, such as O6 cardiology. One question we have been asked is, does this information only need to be on the claim for new patient and multiple services in a day? And the answer to that is, while it's not required to include for every service, your best practice may be to include it if your non-physician practitioners are working under a specialty. And the reason for this is, if you have a new patient service today, let's say, and the patient later sees another non-physician practitioner in your practice, maybe 6 months from now, we would have no way of knowing what specialty the first new patient claim was under, so the second would deny without this information. Another pre-submitted question asked, for family medicine NPs, do we bill these as family medicine or no specialty? Family practice does have a specialty code, so the nurse practitioner may use that to differentiate if it applies to one of our situations for multiple services in a day under different specialties. So here I have some resources related to the information that I've presented today. First is an article that provides detailed instructions on non-physician practitioner billing for new versus established patients and for multiple services in a day. And let's go out and take a quick look at this article on our website. So we'll go back to our website, which again, this is wpsgha.com. And if you don't have the presentation pulled up with a link, you can actually do a search from the top right corner of any page, which I'm going to do here. And I'm going to type in, or start typing in, non-physician practitioner. And you see this actually pops up as our second result. So here it gives the affected specialties for this billing instruction. And if I scroll down a little bit, here we have the details on what situation this applies to. We have how to properly submit this information on your claims. And if I scroll down a little more, we have some examples. So this is really a great resource if you wanted to look at those examples and proper claim instructions and make sure you're billing correctly. All right, back to our resource slide. So the next thing we have here is that list for the 2-digit provider specialty codes, which we did look at earlier. We also have a link in the third bullet for the CMS Evaluation and Management Services Guide, which outlines the requirements for billing different types of E&M services. And then the last thing here is the 1500 to 837P crosswalk, which provides you with the related loops and segments if you're billing electronically rather than on the 1500 paper claim form. We did have a few more pre-submitted questions that I'll address before I check in with Leanne for questions in the chat. The first question just stated, NP billing when the supervising physician is not in the same suite. If this is for incident 2, the supervising physician does need to be in the same suite. Now, if the NP is not working under the supervising physician's plan of care, it would just be billed by the NP. We do have a 2-part series on our YouTube channel with more information on Incident 2 services, which you can find in our E&M playlist, and I've also asked Leanne to place a link to that playlist in the chat. We had some other questions regarding Incident 2, including the plan of care, and that information will also be in these videos. Excuse me for just a moment. My apologies, I had a tickle in my throat. So another question that we had asked about E&M and mental health therapy on the same day by different providers with the same tax ID. And this is not necessarily related to what I presented today, but what I can tell you is that if these services are not related or the documentation supports that they are significant and separately identifiable, both services may be payable. Based on the question, we don't know if these services are related. It might be that the E&M is a physical exam entirely unrelated to the mental health service provided that same day. We had just a few more pre-submitted questions, not specifically related to what I covered today, but I do want to provide you with resources for more information on these topics. One question just asked how to submit claims. We actually did an all-day event earlier this month with sessions dedicated to the life of a claim. You can find recordings from that event in our Medicare Education Expo playlist, and Leanne will be adding a link to the chat. And I actually did a session during that event specifically on 1500 claims and 837P electronic billing. So I encourage you to check that one out. Another question asked where to submit 1500 claim forms. That information is on our website. You can find it under Contact Us, and that'll be in the blue bar at the top of the page. The address is really going to depend on which jurisdiction you're submitting your claim to. And you can also find the videos in the Medicare Education Expo playlist with some more information on submitting the 1500 claim form. We had a question about nursing home visits. Leanna and I are going to be doing a series next month on nursing services, and registration is available in the training center of our website. And Leanne is also adding the registration links to the chat. Lastly, we had questions on proper use of the FS modifier and split shared services. Leanne and I did a series on split shared services back in September, and the recording from that series is available on our E&M services playlist, and you can find a link to that playlist again in the chat. And now I'm going to check in with Leanne for questions. Leanne, do we have any questions in the chat?
We do have one question. So the question is asking, I apologize, I just need to scroll back up to it. So the question is asking, so we cannot bill for same day new patient services if both providers are nurse practitioners, even though one has a subspecialty as a psych provider and manages the patient's mental health.
So for the same day services, if your nurse practitioners are working under different specialties, that's where you're going to want to include that information in the narrative section of your claim. So if it's a specialty that's listed on the page that I showed you and that I have linked on slide 15, you'll want to include that 2-digit code as well as the description for that code to differentiate that they're both working under different specialties. Leanne, anything else?
Ashley, we do not have any additional questions in the chat that have not already been answered.
All right, perfect. Thank you. With that, in a few minutes, you will receive an email to thank you for attending, and you don't want to delete this one without reading it. The email contains your certificate of achievement, and it will look like what you see here on your screen and has your name and contact hours if you need to turn it in for credit towards continuing education units. Now, if you do not receive the email, a few things may have happened. First, you may want to check your spam or junk folder. Also, be sure to add messenger at webex.com to your safe sender list so that any future messages will show up in your inbox. Also, if you joined us today by phone only, you would not have received this email as there's not a way for us to capture your email systematically from our attendance record. No need to worry though. If you joined by phone, you are able to email us with the phone number you joined with. And Leanne will be adding that email address to the chat in a few moments, and we do have it listed on the next slide. There we go. So if you do think of any additional questions, you have 7 days from today to submit those. And you'll send them to our education mailbox and make sure to include E&M correct billing for non-physician practitioners in the subject line so that they make sure those emails come to me. Please keep in mind that I'm not able to access any claims history, so you will want to contact customer service for any claims related questions. All right, lastly, please take a few minutes to complete the survey. Tell us what you liked, what we can do better, and suggest topics for future education. There are different options to take the survey. You can use the link in the chat, or when you exit today, you'll be prompted to go to an external site, and that external site is the CMS Qualtrics page. The prompt will look like the picture we have shown here with a little yellow triangle, and we included that image so that you know that this is safe. It's not malware or anything. For those listening through our website or through YouTube, you also have the same opportunity to provide feedback. You will have a survey card at the end of the recorded presentation. You can scroll to the end to see the link, and the link is also available in the video description. And we wanted to share that we do make changes based on your feedback. Here we've included some changes that we've made recently. Based on your survey comments, we've added chapters to our YouTube videos so you can easily navigate to specific parts in the video that you might be interested in. We've also added training indicators to our education, which will help you better understand if that education is suitable for you. And then also we've started our all-day virtual education events based on survey feedback. These are the Medicare Education Expos that I mentioned just a few slides ago that will focus on specific topics. All right, well, that's all I have for you. On behalf of myself, Leanne, and all of our provider outreach and education team, thank you so much for joining us today. We look forward to your survey comments, and we hope to have you join us again for future events. You may now disconnect.